Good afternoon, everyone, and welcome to International Outreach Programs to Combat African Swine Fever in Southeast Asia. My name is Kevin Noe, and it is my pleasure this afternoon to introduce our presenters, Mo Salman, Professor of Clinical Sciences and Director of the Animal Population Health Institute, and Sangeeta Rao, Associate Professor of Clinical Sciences. Please note that at the bottom of your screen, there is a Q&A box. Please feel free to leave any questions throughout the session, and we will try to get to as many as possible. Additionally, there is a short survey that will be provided to you at the end of this presentation. If you're able, please complete it. And finally, closed captioning is available at the bottom of your screen. And with that, I turn it over to our presenters.
Thank you, Kevin, for such a nice introduction. Hello, everyone. Welcome to our session, which is International Outreach Programs to Combat African Swine Fever in Southeast Asia. Those of you who do not know what African swine fever is, we have a little introduction in the beginning of the slide presentation, and then we will go over what our involvement is in terms of our programs in Southeast Asian countries as well as China. So let me start with showing you what our team comprises of. So we call it as Colorado State University African Swine Fever, or ASF short form team, comprised of Dr. Mo Salman, as Kevin introduced before, who is a professor of clinical sciences, and his specialization is preventive veterinary medicine of infectious diseases. And he is the lead for the CSU African Swine Fever team in terms of our programs in Southeast Asia and China. And then comes me. I'm Dr. Sangeeta Rao, and I'm an epidemiologist and associate professor in clinical sciences here at CSU. And we also have our team member, Dr. Debbie Reynolds, who is not presenting with us, but I would like to introduce her as a part of the team, who is a former chief veterinary officer of UK, and she has played a big leadership roles in UK in various diseases prevention programs, and she brings in policy making as well as strategic planning to this team. And we also have Dr. Steve Weber, who is also not with us today, but he plays a very key role for being a former director of Office of International Collaboration of United States Department of Agriculture, Veterinary Services, Center of Epidemiology and Animal Health. So 4 of us made this team together, and then we provided big outreach programs to all these 4 countries that we will be talking about. So as I said, I will a little bit introduce what African swine fever is. As my slide is really busy, but I wanted to focus on the contagiousness of the disease and high mortality rates and high transmissibility of this disease, which is a viral disease with a DNA virus. And it's highly contagious, as I said, and it also produces serious production and economic losses. As you can see, that the pigs who get affected have this, very visible clinical signs where zoonoses, that's what we call, of the skin, especially the tips of the ears and then abdomen and feet, they're all cyanosed, meaning they're either blue or purple color due to lack of oxygen to those regions. So these pigs who get affected, again, have high fever, and because a high rate of transmissibility, other pigs who are not infected or who are healthy also can get this disease very easily for being in contact with infected pigs. And this picture on the left, which is from USDA APHIS, shows a very good pattern or very good indication that what could be the transmission routes of this disease. First of all, I'll show that, as I said, being in contact with sick pigs is one of the major factors. And then another is contaminated feed, the feed that is given to the pigs. And if it is contaminated with the virus, that could be one of the reasons for transmission to the healthy pigs. One of the very important factor that we don't want to miss is involvement of feral swine. The domesticated pigs as well as the feral swine, I mean the farm pigs and the feral swine pigs, they can actually transmit the disease between each other. So thereby we want to make sure that feral swine are in their own habitat where domesticated pigs are in their own habitat. In the regions that we worked with to put our outreach programs, one of the major concerns was feral swines being intruding into the domesticated areas. So that is one area that we want to make sure we have the control over. And another one is contaminated vehicles and equipment, wherein some of the farms which use contaminated, like the vehicles and equipment very commonly, they share the equipment. So they want to make sure that they disinfect the vehicles as well as equipment before sharing. So that is one of the other factors that we could think of. Another one is contaminated clothing and shoes. For example, veterinarians moving from farm to farm. If they have visited an infected farm, they don't want to visit a clean farm again. So that could be avoided, and then transmission could be combated that way. And again, this one here, international travelers. One of the main transmission factor for this ASF is not only the live pigs, but also contaminated meat and meat products. That is one of the reasons why ASF has transferred or transmitted from one region to the other region, across countries and across borders. So we want to make sure that international travelers who are traveling from one country to another country do not carry any meat or meat products. And one factor that was on main focus in these countries was garbage feeding to these pigs, or we call it a swill feeding to the pigs, to the domestic pigs or the farm pigs, wherein garbage is collected. Either it could be a kitchen garbage or kitchen offals, or offals coming from the farm itself, which are contaminated and fed to the pigs without giving any treatment to that feed. These all factors could contribute to transmission of ASF to healthy pigs. And one good thing is that ASF is not zoonotic. It cannot be transmitted to humans. That is a good news. And one more important thing that we want to notice here is that there is no approved vaccine for ASF. Currently, there are a lot of scientific discussions going on producing a vaccine. Again, that's a whole different story. So biosecurity is one of the areas that we want to concentrate on. Whatever control measures, what I mentioned about in this chart belongs to biosecurity. So I will now let my co-speaker, Dr. Salman, talk about biosecurity in these farms to combat African swine fever.
Thank you, Dr. Rao, for a great introduction. And welcome everybody on this call. I want to just re-emphasize on some of the uniqueness of this disease and the infection. As Dr. Rao indicated, is first of all, this is a viral disease. The virus is a DNA virus, is not RNA virus like we see, especially with the COVID. And because of that, the virus has more like resistance to the environment. That's the reason, as Dr. Rao indicated, the different route that for the transmission of this virus. And the resistance is not only to the environment, but also could be a stay for life for a certain period of time in the meat or the pork or the products from the pigs. In addition, which is also another uniqueness of this virus, is transmitted by what is called the soft ticks. And these soft ticks could live up to 7 years and also could really be major important part of that. As Dr. Rao indicated, the role of the wild pigs or wild boars as it's called, or feral swine, as we call them here in the United States, is a very important part, because the reason is because first of all, they are susceptible and they can move, and with the movement, they can also move the virus and the infection with them in that way. And as Dr. Rao indicated, one of the uniqueness of this disease is the lack of a vaccine. And a lot of the question, as she indicated, like how come we have this disease, and knowing how the disease can have a serious impact on the swine production, why we don't have a vaccine. It's mainly there are several scientific reasons for like the lack of the vaccine. There are people who have been working on production of a vaccine, or at least to research vaccine for more than 30 years, and all of the efforts will be not successful. Giving all of these facts, and giving that our mandate and our reason to work with this ASF in the region is first to control the spread of the disease, but also to prevent from the spread to another countries or another region. And so when we put all of these facts together, the biosecurity will become a major issue that we need to work with in terms of intervening with the cycle of that disease. Next slide, please. So working with biosecurity, in my opinion, is a piece of art, but it also has some principles and some scientific concept that is need to be known. And when I say the piece of art is mainly to have like common sense for a specific practice. And particularly when we said specific practice is to take into consideration the type of production of animals, but also the culture and the economic aspect, and also the availability of whatever we would like to consider as a measure in prevention of the spread. You could see from this slide on the right upper part is this is a very simple chart, and to show like what's the meaning of a biosecurity in that respect, but also to show in the slides below is the complication, I would say, giving the culture and giving this social customs there in the region, in terms of like both from hygienic aspect, but also from a production of food, and also to how to build to cook the food and how to serve the food in general. Giving all of that in any type of biosecurity measures that it has to be really like very practical, but has to be also effective in that way. The list on the bullet statements are mainly like some of the potential very general items, what it can be done, whether for the African swine fever, but also could be for other diseases in the area. Next. You go for it.
So thank you, Dr. Salman, for giving a very good introduction of biosecurity measures, especially for the African swine fever, not only for that disease, but generally also. So I will move ahead with showing you this busy slide again, which was the main goal of the whole project, that Dr. Salman being the PI for the project and funded through USDA International Services. And we our team got to work on this outreach program. So the goal was to provide specific technical assistance, including like training between CSU and animal health authorities of 4 countries, as I mentioned. The 4 countries being Vietnam, Cambodia, Laos, and China, with the aim to foster the existing collaboration. With some of the countries, we already have existing collaborations before ASF project itself. So we took that as a platform to build upon that and build this ASF training or the outreach program in these countries. And overall aims being to enhance basically technical capacity of animal personnel, for example, animal health officers and veterinarians working in the field, as well as the laboratory, to be able to provide reference services in disease investigation and disease management strategies, specifically with ASF outbreaks that were happening in these countries. And one of the points that I want to mention here was this surge of ASF started happening from 2018 from China, and then spread to other countries nearby. And also our aim is to conduct a technical assessment of current field operation systems for surveillance, detection of ASF, and response operation options among disease investigations, and conduct training workshops in each of these countries. Because it was the pandemic situation that happened during this time, so we could not accomplish everything, but only the outreach programs which we could accomplish being remote were very successful during that time period. And bringing all these aims together, our main goal was to assess the training needs of the field veterinarians to provide the required services to control the spread of ASF. And also we wanted to participate in sensitization of these middle level decision makers in the veterinary field to provide them knowledge and value of epidemiological tools in taking appropriate mitigation strategies for disease control. So since we brought these outreach programs together, I wanted to show you this chart here, what was the importance of these outreach programs, especially for African swine fever. One was to build a two-way learning concept between the trainers and trainees. We said two-way learning because not only the trainees learned, but we also learned a lot during this process, especially building this program for each of these countries was challenging, as well as a different set of recommendations and different set of training itself because of the needs of each country. And the outreach programs also differentiate between the education and building professional skills through mentoring and coaching. In some of these countries, we got to mentor each individual trainee on their individual task or the project itself. And in some of the countries, not only for ASF, but before that, as I said, we built these outreach programs on the existing collaborations that we have in some of the countries, especially China. We have already existing international memorandum of understanding with the Epidemiological Center in China. So we built case scenarios or case studies in this country based on other diseases. So we took that opportunity to build training program for ASF itself. And the outreach programs also requires trainers as facilitators. We're not like teaching them, we are like facilitating. They already have the knowledge, but we are discussing with them and trying to find out what intervention strategies will apply in that country, as well as where they could intervene versus where they could build capacity in their countries. So we feel that this is the building these outreach programs specifically for African swine fever was the best way to promote academic and scientific approaches, especially with regards to epidemiology. So our involvement, as I mentioned, was Cambodia, Vietnam, and Laos PDR, which are the Southeast Asian countries, Cambodia, Vietnam, and Laos, if you can see my cursor, as well as China. So those being very neighboring to each other, that was for us the region to be focused. Because one of the reasons was these countries officially reported the disease in that year from 2018 to 2019. And as I said, that we already had existing collaborations with China, especially we had IMOU with China before. So I will show you specifically, like in each country, what kind of program we built and what impact it had. So I will start with Cambodia. For Cambodia, one of the very successful programs that they have been implementing in the past, and CSU was involved in the past, also was Cambodian Applied Veterinary Epidemiology Training Program. And this is the 7th cohort that they were training. And they select about like 20 to 25 very young animal health officers from the field who just graduated from veterinary school, and then they are working in the government service. They select them and train them in the field in epidemiology, especially like outbreak investigation, how to put up surveillance programs, how to do sampling. So those kind of practical approaches they teach those cohort of trainees. And they call it as CAVET, the short form for Cambodian Applied Veterinary Epidemiology Training. So we got involved because due to COVID pandemic, we could not travel there. So we put a training program together, being remote, virtual. As you can see our faces that we were really sleepy at that time because of the time, because sometimes the trainings went until 2 a.m. in the morning. And that was very effective. That's what we felt. It was very effective in terms of not only training, but also a dialogue. We could participate in a dialogue between the trainees. So with regards to field work, we could not be there in person. Hence, we were not able to like contribute to the field work there. As you can see, the trainees were not only trained in the swine medicine, but also in other livestock. So they were taught how to bleed the animal. They were taught how to like detect the disease, how to isolate the animals, and etc. All the epidemiological skills. So one of the challenges was also translation for us. Although we call it challenging, but it was a learning process for us because we had to speak in English and somebody had to translate in their own language. So translators played a very, very huge role. They were very trained translators who would simultaneously translate our language into their own language for the trainees. And the trainees were fortunate enough to meet in person there. Only international travel was restricted, so we could not go, but the trainees themselves could gather within the training room itself and were able to like communicate with each other and have discussions. So we built our training program not only on like very basic knowledge of infectious disease processes, but also something like discussion on case scenarios. So we built case scenarios and gave them questions to discuss among themselves and come back to us to have a dialogue between CSU as well as the participants, as well as the trainers who were already in Cambodia, and they were animal health officers in a higher federal level, government federal level. So one example here, 2 examples here is one is on backyard pigs in the region, and we talk about biosecurity here and talk about what are the weak points. They have to identify the weak points and discuss about what they could do to prevent these situations. And another example is where they have to identify the strong points of biosecurity here, and then identify the main limitations and how they could be improved in the region. So those are 2 examples I've given here, but we built a lot of other scenarios for discussion so they could discuss among themselves and get back to us, and then we can have a dialogue between them. So that was about the Cambodian veterinary training program that we built. And there were like at least 5 projects from the trainees that were specifically for African swine fever. So for the African swine fever projects, every week we would meet with them and then discuss on their progress, as well as any questions if they had, and how we could improvise or how we could provide suggestions to conduct the research itself. So that was about Cambodia. I will move to Vietnam and I'll let Dr. Salman take it over.
Thank you, Dr. Rao. I just want to add also about Cambodia. As Dr. Rao indicated, we were involved in that field training in epidemiology way back. I believe it started in 2006. So we've been with them in the field, and we know some of the situation, and including like we train the current organizer and coordinator for this program. So we were fortunate in that way. So when we went with the Zoom meeting, is not like it's coming from a vacuum. So it was also a good experience to work with remotely with them, especially being the middle of the night, and we worked with the 3 different significant time zones, like one in UK and one in Fort Collins and one also in Cambodia. Now let's move to about Vietnam. As Dr. Rao indicated, part of the overall aim of this project, as we agreed as a cooperative agreement with the USDA, is to assess and technically in preparedness plans, but also with the current situation in terms of the infrastructure of their animal health programs in the country. And that was very obvious when we went to Vietnam, and we were in Vietnam, and in the beginning of the outbreak with the ASF, and you could see from this piece of paper or the newspaper, there were a lot of pigs killed in that time. Is 1.3 million pigs were destroyed because of the virus. But it also came in a time in which, like, they do have the main annual holiday festival there, and they consume a lot of pork. And you could see like the high-level senior officers in Vietnam were very involved to promise the people like they will not really like reduce the pork market in the country. So we work with a very, I would say, specific, what they call national action plan for the ASF. Fortunately, they share it with us, and we work with them both when we were in the country, but also when we came back here, in putting, or at least what I would like to say is some suggestions and challenging questions to make the plan as much as possible practical. And I'm not planning to go in all of the detail with that way, but that will require face-to-face interaction, but also, as I said, specific challenging questions, and some maybe suggestions for solutions for this type of things that it happened. And I will give one example. Like, I mean, the plan where in the beginning when we saw it is they said we are planning to live with the disease as endemic in the country. But in the same plan, they said we will work to eradicate the disease within the next year. So we thought like at least they need to coordinate what they mean by these things. And they were listening to us, even though, as probably a lot of you know, is Vietnam is very authoritarian government, that it's hard to really convince them in one way or other in that respect. We worked directly with senior officers. As you could see from the picture, our entire team met with the senior officers in the Ministry of Agriculture, what is called the National Animal Health section of that, but also we observed and tried to understand what's going on in the field and questioning that. I would like to emphasize here about as Dr. Rao indicated, the role of Dr. Debbie Reynolds, mainly because of her engagement or former engagement with in UK and also with the European Union in terms of setting policy and strategies for animal health program, and she is, by the way, is an affiliated faculty members of our department here. And her involvement was very useful to bring the reality and the practicality in that respect to the entire team, but also for the host countries in the situation, Vietnam. Next slide, please. And part of our assessment, which was required by the cooperative agreement, part of our assessment of the existing activities related to the ASF, to meet with the, as I said, senior officers, but also with the other stockholders in that respect. We were fortunate to meet with very good NGOs. It's mainly is the European one, but they are involved in the field and specifically with the backyard pig farmers, which we felt like it needs to be included if there is any type of control programs in that way. But in addition to that, we met with the biggest company in the country. Actually, they are responsible for approximately 80% of the pork production in the country. And we try to at least work with them and challenge them with their standard of operation and how they can involve or engage high level of biosecurity to maintain the disease in that way. So I feel like is at that time, and I will repeat what Dr. Rao was saying, is a two-way learning. We learned from them what they do, but also that we challenge them with some of the technical aspect and the scientific aspect that they could consider in that way. The picture is on the upper right side. It shows like the meeting like we held with the what is called the Vietnamese animal health delegates to the Global Animal Health Organization in Paris. And that's where I would like to say is the highest senior decision maker in the country, but also the person who represents the country internationally. So, and we, during that meeting, we had some ideas about like what they mean and constrain the disease and how we can put it in action in that respect. Unfortunately, after that meeting, we were planning to follow up with another field visit with more solid recommendation and suggestions. But that visit, by the way, it was January 2020, which is, we were there when is the Wuhan virus came in the news as an beginning of the pandemic occurred in the region. So it's all our movement were paralyzed after that. Next slide, please. We attempted during the January visit also to have to go and visit Laos and to do the same thing as we did in Vietnam. And we attempted as much as possible to meet with the senior officers there. And you could see like in the picture where myself and Dr. Reynolds were there and meeting with the senior animal health officers in the country. And we had like maybe 3 or 4 sessions, I call it dialogue, as far as how they deal with the ASF in the country. Laos is a very difficult country, even is more difficult than Vietnam because it's just really like they depend on a lot of international funds and aids, and therefore it's very hard to do things without showing the money, as they will call it. Again, we try to after the outbreak of the COVID, we try to follow up with them, but unfortunately, as the enthusiasm from the senior officers were not so great. And I should say, like, that was not surprising for me, because we had similar deal with them in the late 90s on another disease, foot and mouth disease. And I found like it's very hard to do that without the real being in the field all the time with that. But we were fortunate to get some input from technical people and cooperators there, and mainly through two organizations. Both of them is an NGO. One of them is the European, what is called the agronomist veterinarian, which is mainly equivalent to the Doctors Without Borders, but here is mainly for veterinarians and agriculture economists, and is the headquarters is again in France, and we work with them, and they have really like a good field people in that local people that they are really anxious to learn about the biosecurity and to learn about the ASF. In addition, we also worked with well-organized, well-recognized wildlife conservative societies, like is known across the world. And during that wildlife conservation society, we have also the access to the wild boars and the feral swine in the area, and try to build that in that way. During the dialogue with them, they identified certain gaps in the knowledge and the training programs. And by the way, we met with them when we were in the country, but majority of the after that meeting is the follow-up. It's done through the Zoom meetings. So we propose according to what they recognize, similar to what we did in Cambodia. We did like a couple sessions in relation to the knowledge and how we can extend that to the field. And as Dr. Rao indicated about the Cambodians, it's the same thing happened here in Laos. We found like the field people are very anxious to learn, and they participated in the dialogue and talking, but is remotely is not the same as you could sit with them in face-to-face. Okay. I would like to say is, as the work on the role of the wild pigs in the region related to the ASF is not well known, okay? It is not the same as in Europe. First of all, we feel like is the role of the wild pigs in the region in terms of spreading ASF, at least what we could recognize, is not as important as what's going on with the same thing in Europe with the wild boars. However, it still needs more evidence, like what they can do and where are they. And unfortunately, in Laos, there is, for example, a farm in which like they maintain wild boars, and that for breeding and for marketing, and that farm it's unknown in terms of like whether they have the ASF and whether they do have good and reliable biosecurity or not, but is under the control of the government, and we could not reach that level. So there were some limitations in that respect. Next slide, please. Now we move to China. Again, is as introduced by Dr. Rao, our work with China through the China Animal Health Epidemiology Center, CAHEX, is established before China declared or reporting about ASF in the country. It started as mainly through an IMOU, that is, we build it because they need our technical help, and we build it as mainly for an exchange program. We participated prior to the official report of ASF in training their field animal health officers in how to do an outbreak investigation. And it came in the right time, because then when they had the ASF, they tried to establish and do exactly what we tell them in these training programs. And that will actually, we were very happy with the way they did, and we encouraged them to put it for the scientific community through publication that was published in scientific journal, as you could see from the right upper face in that way. I should say, well, CAHAC is well recognized in China, is a federal, so is a central government entity. They are heavily involved in both the field operation, but also in the policy and the decision when it comes to the animal health programs, but also recognized by the Global Animal Health Organization, OIE, in Paris as a collaborating center for the entire Asian region. That's how we started to work with them, because they contributed both in technical but also in financial aspect to other countries in the region in terms of the animal health. We found them that they were very open and very cooperating in a lot of ways with us. Unfortunately, when COVID came, and also because of some of the political issues in the beginning of the COVID, is the line of communication was really reduced significantly between us and them. And now we are trying to reestablish it again in that respect. The CAHAT is very important for the region, but also for ASF. And I just want to say is, which we did not really mention it from in the beginning, like ASF is not a zoonotic, as Dr. Rao indicated, but it has a major impact, okay, on the food security, and especially in white meat, okay, if then other countries will get the disease, okay. And most recently, officially now, Thailand declared like they do have ASF. And if you combine China, Thailand, and Vietnam, they could between the three of them, they contribute to the around between 35 to 40% of the pork production globally. I'm talking about it globally. And the most important other aspect I will indicate now is ASF recently in December was reported and the first time since before 2000, reported in the North America or the Western Hemisphere. The first time it was in Haiti and also Dominican Republic. And we are lucky because what we have like USDA were prepared for dealing with that, okay, and they work very closely with these two countries. We managed, and I really would like to say that is our experience from the region, Southeast Asia region and China has helped in building a good program within USDA, because that experience led to the what can work and what cannot work with that one. Currently, United States has not seen the virus in our pig population. The estimation is like around 70% of our pork produced in the United States is for export. And if the ASF will come here, that will shut immediately the international market in that respect. Next to you, Dr. Rao.
Thank you, Dr. Salman. So just to wrap it up, due to like the time is almost like 2:45. So achievements and impacts, we put that into like 3 sections here. So the first one being establishment of professional network. As you could see from other slides, previous slides mentioned, from those 4 countries, there was a good establishment of professional network because of the interactions that went on during all these outreach programs. One was ability to share the disease reporting. We receive time to time reports from the Food and Agriculture Organizations of the UN about what is going on with the ASF in terms of their spread and any detection of new cases. For example, as Dr. Salman mentioned, it was detected in Thailand for the first time. Then we received those reporting also. And also clarifications of disease mitigations and consultations of disease management policy. So for all these, it was a good establishment of professional network. I would say continuation of professional network from the past. And also these interactions brought CSU to be recognized internationally, in addition to what has been done in the past. APHI, Animal Population Health Institute, that is where Dr. Salman is the director for that center. And that center is a reference center for veterinary epidemiology and disease surveillance for the Food and Agriculture Organization of the United Nations for the past many years. So that continues to be there. And as mentioned before, again, we signed an international memorandum of understanding with the China Animal Health Epidemiology Center. So that again was a platform for these interactions for African swine fever. And we also shared lessons gained and experiences with a USDA officer with regards to ASF threat to the US pork industry, as well as what SWOT analysis was like, especially the strengths, weaknesses, opportunities, and threats with regards to all these programs were shared with the USDA officer. To be able to bring those experiences and lessons gained to the pork production units or pork, the federal government working within the pork industry. So all these together are very important to have what I call involvement of CSU within not only ASF, but also any infectious diseases pertaining to animals, which could be zoonotic or non-zoonotic. So I would stop here and probably take any questions for both Dr. Salman and me. But I do not see any questions that are posted unless, Kevin, if you could see any questions. So we'll be happy to answer any questions.
See any at this time. We do have about 2 minutes left, so I think we will just start to wrap it up here. And I will say to any of our audience members, if you do have specific questions, please do reach out to our presenters. At this time, I would like to thank Dr. Salman and Dr. Rao for your presentation today and all the wonderful work you're doing on this important topic. To everyone that's in attendance this afternoon, thank you so much for being here. We still have one more session today and several more tomorrow. So we do hope that you'll continue to join us. Again, if you have a moment, please complete the short survey after this session. And finally, once again, thank you so much for being here to our 2 presenters.
Thank you.
Thank you.
Have a good rest of the day. Thank you.
Yes.